Hello, P4 students. I hope you're all healthy and gaining vital knowledge from your experiential rotations. I wanted to just take a few minutes to highlight an important issue related to our current situation. We're all certainly learning new lessons and coming up with new ways to do our work and self-education in the context of this pandemic. I realize Dr. Grofley and his team in the experiential office has been in frequent communication with you, but I would like to focus on just one, albeit critical component to our lives. As a student, we make sure your clinical recommendations are vetted by practitioners. However, regardless of what patient care related rotation you are on, you can be directly influential on the life or death of patients who are highly susceptible to the worst outcomes from COVID by potentially infecting them. This is because we are all potential carriers of COVID, regardless of any active symptoms. Of course, we expect strict compliance with wearing masks when social distancing is impossible. However, I want to highlight the need for you to protect yourselves, your preceptors, and your patients by being very vigilant of social exposures to other people when you are outside of your experiential time. This includes being very careful about your social interactions and avoiding large group events. I hope you can see that even though you are not yet a graduate, you are just as important in protecting the healthcare environment. In other words, you need to look and limit your potential exposures to COVID similar to frontline workers and to a different level of care than others in non-medical disciplines or jobs. We have already had several students who were exposed to friends who ended up testing positive. While this is not totally unavoidable, you need to be very careful to do your best at maintaining social distancing and wearing masks. The primary job of the mask is to protect others if we are potentially spreading, so asking any friends to keep you from spreading the disease is certainly appropriate. None of us know at any one moment if we are carrying the virus. Importantly, spread is thought to often occur before any symptoms, and people of your age range can be infected when they have little or no symptoms. Our experiential office has been working diligently to keep you on rotations during this pandemic, given some site closures, etc. However, there is certainly a limit to our abilities to change sites, and we need you to help us keep those sites active so everyone can have the best chance of completing the PharmD program in time next spring. Please visit the website coronavirus.wvu.edu for any updates, as it's a fantastic resource for lots of information and hyperlinks. Our experiential team has recently provided you with a comprehensive email outlining the process should you be potentially exposed. So please stay safe and absorb as much as you can during this highly influential time in your early professional career.